MagVenture's TMS systems are primarily used for treating depression and offered to patients not responding to medication. Let's review the MagVenture TMS Therapy system. The stimulator is the heart of the system. The stimulator is mounted on a trolley, along with an isolation transformer, vacuum pump, and cooler unit. The magnetic coil produces the magnetic pulses required for treatment, is attached to the stimulator. The treatment chair is a fully adjustable reclining chair designed for the comfort of the patient. Mounted to the treatment chair is the flow arm for easy and flexible positioning of the treatment coil. The vacuum pillow complements the treatment chair as it ensures the patient's head remains stable during the treatment. Start the first treatment by going through the procedure step by step, together with the patient explaining the areas of the brain that are targeted and how the TMS pulses will feel, including the potential treatment outcomes. The initial procedure requires a treatment cap, Nation ruler, tape measure, marking pen, and earplugs. First, measure the circumference of the patient's head to find the right treatment cap size. Be sure the cap fits tightly to the patient's head, ensuring the blue line is central. Measure the distance from the nation to the edge of the cap. Write this distance and patient's ID in the specified areas. To find the area of the scalp above the motor cortex, first identify the location of the nation and inion. Measure the distance between the nation and inion along the midline of the head, using the blue line as a reference. Locate the halfway point between these two landmarks and mark this on the cap. Next, measure the distance between the tragus of each ear. Be careful to have the imaginary line joining the trachea pass through the halfway point between the nation and inion. Find the halfway point between the trachea and mark this as the vertex. Make a mark at the point along the midline 5 centimeters anterior to the vertex. Make a mark at the point on the left side of the patient's head, 5 centimeters lateral to the vertex along the imaginary line joining the trachea of the ears. Draw a dotted line between the 2 points. For patients who are anxious about the procedure, applying a few stimulations to the forearm may help familiarize the patient with the stimulation. Begin to look for the motor hotspot along the diagonal line, starting near the most lateral part of the drawn triangle. Deliver single pulses with a few seconds gap at an intensity of 40 to 50%. If no response is observed, gradually increase the intensity and map around the area until a response is seen. The motor threshold is established by observance of a visible muscle twitch of the right hand. The lowest possible stimulation intensity needed to get a visible twitch of the thumb represents the patient's motor threshold value. Once the motor threshold is found, trace the edge of the motor threshold coil directly on the cap to mark the placement location of the treatment coil. Ensure the patient is okay to proceed with the treatment. Now switch from the motor threshold coil to the treatment coil. Ensure the coil cooling system is switch on and liquid is flowing. Use the remote control connected to the chair to adjust the footrest, seat, and backrest to recline the patient into a comfortable position ready for treatment. Fit the vacuum pillow around the patient's neck, being careful that the pillow does not protrude above, but approximately at the level of the patient's ears. Use the foot switch to activate the vacuum pump and evacuate the air from the pillow to fix the patient's head in place. Make sure the patient is comfortably seated with their head stabilized. Align the coil on the treatment location by using the contoured line drawn on the cap. Making sure the coil is placed tangentially to the head. The center of the coil should be in good contact with the scalp. Once the patient is positioned and the treatment coil is placed in the correct location, the operator can specify the TMS treatment parameters for required treatment. The treatment program can be determined in two ways: set the individual parameters for the required protocol from the timing menu, or select a pre-saved protocol from the setup menu within the main menu. Once this has been set and checked that the treatment parameters are correct, the treatment can begin. Occasionally, check in with the patient to see how they feel and to help them to feel relaxed. The patient should be monitored continuously during treatment to ensure their safety and comfort. When the protocol has reached completion, remove the coil from the patient's head. Release the vacuum from the pillow by opening the valve. Readjust the chair to allow the patient to get up without difficulty. Remove the treatment cap. Check that the patient is feeling okay. Lift the treatment chair arm. Reevaluate the patient is okay and allow the patient to leave. After the TMS treatment is over, the patient walks out the clinic and goes back to normal activities and returns next day for another treatment.